Welcome to our video series about knee arthritis and knee replacement. The following videos will walk you through the process of preparation and recovery from total knee replacement. We want to thank you for entrusting your care to us. As a practice that specializes in joint replacement surgery, we have built a comprehensive program called Avatar that is designed to facilitate the recovery process and improve outcomes. Our team of physicians, physician assistants, nurse practitioners, and office staff are all highly dedicated to the Avatar process and to our patients' end result. This manual is your guide to the Avatar knee replacement program and is meant to help you prepare for surgery and maximize your recovery. If you have any questions that require further information after reviewing this material, please contact us at any time at the information provided here. There's a lot of information in these modules, and it is important that you take the time to watch these videos and read the handouts so that you are fully prepared for your knee replacement and have a realistic understanding of what to expect. We have broken this material into several modules so that you can review the different aspects of the care episode at your own pace. It may be best to review this material more than once so you can fully digest the information. Please refer back to these modules periodically as a resource of information. The knee consists of three different bones: the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. In addition, there are key tendons and ligaments that move and stabilize the knee during everyday activities. Knee arthritis occurs when the cartilage that forms the smooth gliding surface of the joint wears away and exposes the underlying bone. This results in pain, stiffness, and deformity. Arthritis is a progressive process that worsens with time and has no medical cure. These X-ray images show a normal and arthritic knee. The arthritic knee shows narrowing of the space between the femur and tibia due to cartilage wear. This results in bone-on-bone, as shown by the orange arrows. In moderate to severe cases, wear of the bone can also cause deformity, as seen in the picture on the right, showing a varus or bow-legged deformity and a valgus or knock-kneed deformity. The following is a general guideline for when a knee replacement is appropriate. The level of pain is moderate to severe and significantly impairs your activity level. You find yourself avoiding certain activities that you would otherwise do because of pain. You have maximized conservative measures like medications, injections, exercise therapy, etc. And your quality of life is sufficiently impaired to warrant the surgery and recovery. The tipping point is the point at which patients decide they no longer want to live with the pain and limitations of knee arthritis. This point is different for everyone based on each individual's threshold for putting up with pain and activity restriction. Patients often ask us, "How do I know it's time for surgery?" And we generally respond, "You will know when you reach your tipping point." What is a knee replacement? Knee replacement resurfaces the worn joint with implants affixed to the bone. The implant consists of four pieces: the femoral implant, which goes on the thigh bone, the patellar button, which goes on the back of the kneecap, the tibial component, which is affixed to the top of the shin bone, and the bearing surface, which goes between the tibial and the femoral component. These implants are cemented to the bone after measured cuts are made to ensure proper implant orientation and restoration of limb alignment. Your surgeon will choose the implant size that is best suited to recreate your anatomy. Soft tissue balancing may also be done to ensure joint stability throughout a full range of motion. While advancements in implant design and surgical techniques have improved outcomes and longevity of knee replacement, this operation does not give you back an entirely normal knee. The main goal of knee replacement is pain relief. That said, many patients with a knee replacement may have some minor activity-related discomfort that should be significantly improved over your preoperative status. A small percentage of patients continue to have moderate pain after knee replacement despite what appears outwardly to be a successful surgery. The reasons for this continued pain are not always clear, but ongoing stiffness is one common potential cause. A normal knee may have a range of motion from 0 or full extension to 150 degrees or full flexion. An arthritic knee often has a reduced range of motion with some loss of both flexion and extension. A knee replacement will typically achieve a flexion range of 115 to 130 degrees. Postoperative range of motion can be impacted by preoperative stiffness, surgical factors, genetic factors, and successive rehabilitation. This range is generally sufficient to perform a majority of daily activities. Knee replacements are very durable and generally permit patients to return to a high level of recreational activity. Biking, hiking, racket sports, skiing, and other sports are permitted provided patients achieve the necessary level of strength and range to permit this. Repetitive impact activities such as distance running are generally discouraged, but some patients may choose to do this. Kneeling is permitted, but some patients find it uncomfortable due to sensitivity of the incision scar. You should anticipate that should you desire to return to a very high level of recreational activity, you may continue to have some swelling and mild discomfort in the knee after strenuous use.